Hello guys and welcome back to my channel. Let me start by apologizing for not uploading videos earlier, but as you may know, I have been very busy with the COVID-19 pandemic and I have been extremely overwhelmed with my work in the clinics. So we would like to move on to a new topic, a new series of videos, and this series will focus on the COVID-19 infection. This video will look at the basic microbiology, the virology of the disease. Please note that this will not be a detailed discussion on the virology. I'll just be discussing enough virology to deal with the clinical aspects of the disease in the later videos. I may do a more detailed virology video in a later time. So with that, let's move on. The COVID-19 is caused by a virus in the family Coronavirinae. There are two subfamilies, which are the Coronavirinae and the Torovirinae. We will be focusing here on the Coronavirinae, which has four genera: the alpha coronavirus, the beta coronavirus, the gamma coronavirus, and the delta coronavirus. Now, most of these viruses, these four genera, are not important in humans, and we would like to focus here on the beta coronavirus genre, which contains the SARS and the MERS. The SARS is the severe acute respiratory syndrome disease, which was in 2002, and the MERS is the Middle Eastern respiratory syndrome, most of which has been reported in Saudi Arabia from 2012 onwards. This family also contains the SARS-CoV-2, which is the SARS coronavirus 2, which is responsible for the COVID-19 infection. If you look at the morphology of the coronavirus, you can see that it is a globular in structure with multiple proteins sticking out of its surface, and this gives it a crown-like appearance, which gives it the name coronavirus. Now, if you look at the cross-section of the virus, you would see that it is a globular structure with proteins sticking out of the surface. There are multiple number of these proteins which are important clinically. We will talk about those. There is the S protein or the spike protein, which is important in the pathogenesis of the disease in humans. There is the M protein or the membrane protein, the envelope protein or the E protein, and the nucleocapsid protein onto which the nuclear material is attached. So again, they are known as the S protein, the E protein, the M protein, and the N protein. The S protein or the spike protein is important in the pathogenesis of COVID-19 in humans. If you look at the wall of the virus, you would see that the wall is composed of a phospholipid bilayer. The phospholipids are composed of a hydrophilic head and a hydrophobic tail, as shown here. And the hydrophilic heads are oriented outwards and inwards, and the hydrophobic tails are sandwiched in between. Now, this would mean that the structure of the virus, the wall of the virus, would have a similar appearance with the hydrophilic heads pointed outwards and into the virus structure, and the hydrophobic tails sandwiched in between these. Now, this means that in an aqueous environment, the phospholipids arrange themselves in the bilayer, and this gives it structural integrity and rigidity, and also allows the proteins to exist within the wall of the virus with structural rigidity. We'll stop for now. Please don't forget to subscribe to my videos and ring that notification bell. And also thank you very much for watching my video, and see you in the next video. Thank you.